Hi there, my name is Sharon Caravetta. I'm a nurse practitioner and I work in primary care. However, I also work in aesthetics as well. I've been doing Botox and fillers for about 7 years. And I have patients that come in all the time with questions, especially about Botox. And so I decided to put together this quick little introductory Botox 101 presentation. It's not for those Botox veterans out there. This is very introductory, and hopefully it will answer some of the questions that you may have about Botox and make you feel a little more comfortable with it. At the very end of the presentation, I have provided my email. So if there are questions that you have that didn't get addressed, feel free to shoot me an email and I will get to those. You can also book a consult with me in person. I see patients at Fusion Medical Center in Scottsdale. I hope you enjoy the presentation. So what is Botox? Botox is actually a medication that we inject into the muscles. It is a neurotoxin, and yes, it is related to the same botulism toxin that people have heard about that is related to food poisoning. However, this is completely different. It's highly purified, it's made in a controlled setting, and it has to meet FDA standards of quality in order to be able to be used. These are, again, FDA approved, and they are purified, and they are very safe when used by medical professionals who have been trained in their use. So Botox has been around the longest. So we have a lot more data on the effectiveness and safety of Botox. However, there are multiple neuromodulators on the market now, and they are all essentially derived from the same type of neurotoxin. So one could gather that they will be equally safe and effective. There are differences in dosing, so just be mindful of that when you're shopping around and comparing. So where do we inject Botox? Actually, we inject Botox into a lot of different areas. However, the three most common areas requested are going to be the forehead or frontalis muscle, the crow's feet or periorbital muscles, and the 11s or glabella muscle. Also of note, the FDA has approved these three areas as being the areas that are considered on-label use for using neurotoxins in order to diminish fine lines and wrinkles. First up, we're going to talk about the 11s, the glabella region. What's important to know about this area is that people can start to develop fine lines and wrinkles that start to be present even when they're not making a scowling face or an angry face. And as those lines start to develop, they can become actually pretty deep. It's a great idea to start treating that before that happens. As long as the lines are minimal, then you can usually resolve them pretty easily with Botox treatment. As they start to get more and more deep, it may require additional tactics in order to address that issue. So another thing I want you to note is that the amount of treatment per area can vary. It depends on the look that the person's wanting to go for. I have some people who really want to keep some movement in that area. They say, you know, when I look mad, I want to look mad. That way my kids know I'm mad. And then I have other people that are like, really, I don't want that muscle moving at all. I never want to look angry. I want that almost frozen out. So you can literally have patients that want it either way. And we're easily able to accommodate that. That average amount, I would say, that we put, I find, into the glabella is going to be anywhere between 15 to 30 units. And again, that is a small area, but it's a very strong area, especially for men. That area can be quite strong. And it's important to also note on these pictures for this one, as well as the next two coming up, I want you to note that in between Botox visits, even though the Botox does wear off, what you'll notice is that the before picture on the left compared to the before picture on treatment number 3, you'll see that even though the Botox has worn off and it's time for their next treatment, it didn't come back as strong. What that is muscle atrophy. So over time, when we keep treating muscles and we don't let them come all the way back to their full strength, those muscles do stay weaker and weaker. And this is an important component in staying up on your Botox. If you get it done once a year, you've let that muscle come back to full strength. So what you want to do is make sure that when the Botox starts to wear off and it's no longer there, you want to make sure that you get in and get that retreated so that we can start having some overall weakening of those muscles that are a little overly strong and creating those lines that we're trying to resolve. So the next area is the forehead, also called the frontalis muscle. What's important to note about this muscle is kind of depends. Some people have very large foreheads and some people have very tiny foreheads. And that makes a difference because we've got to be able to cover that whole space. So again, dosing can vary. This is just an average, but I would say on average anywhere from about 15 units to 25 units would be what I would expect to treat in a forehead. And again, that can be changed whether the person wants a very strong, noticeable frozen appearance, or do they want to be able to keep some movement in their forehead. It really does vary on person to person and what you want. So that's why it's really important that you communicate this with your aesthetic provider so that they know your preferences and can help dose that accordingly and space it in a way that you're going to be able to be happy with your results. One thing that is important to notice for people who've never done Botox before, sometimes when you treat this area, you can have a sense of heaviness. It feels a little heavy when it starts to kick in. For this reason, for my people who are brand new to Botox, sometimes I'll do a baby Botox for this area just to make sure that they're not gonna be driving themselves crazy. The first time I had Botox put in my forehead and they went too heavy, even though it looked fine in the mirror, it really didn't feel good and it felt like my face didn't feel quite right. And so for that reason, I always tell people you can always add more Botox, but it doesn't hurt if you're a little bit nervous about changing the appearance of the lines in your face anywhere. It never hurts to do a baby Botox. So go light on it first and see how it looks. And then you can always add more later and have a better idea of what it's going to feel like. So I kind of feel like it's almost like Botox on training wheels sometimes to do those baby Botox, and then you can get comfortable with it. Again, you can notice that over time, those lines will start to appear less strong even when the Botox is worn off. And this is, again, because of muscle atrophy. And I feel like this happens pretty substantially in the forehead because even though it is a muscle that takes up a large space, it is actually a very thin muscle and it's not the strongest of muscles, but it can get expensive depending on the size of your forehead. So the next area is the crow's feet area, and this is going to be an area that can have a lot of variation in how much we treat because a lot of times people are looking for more prevention as opposed to working out the lines. And then also sometimes people will prefer to try to get a little bit of a lift to the eyebrow. And even though I will talk soon about how Botox does not lift anything, there is one way in which we get around that. And there are muscles around the eyes that are in a circular fashion. So the eye muscle is a circle. And what we can do is relax some of the part of the circle that is pulling the eyebrow in a downward fashion. This allows the muscles that bring the eyebrow upward to not have that opposing downward motion. And then it allows the eyebrows to actually lift. So we've talked a little bit about the ways that we use Botox on label, but there are a lot of ways that we can use Botox to enhance appearances and address other concerns that are off label. I will try to save most of that for maybe our Botox 202 presentation. But for now, just know that there are a lot of different applications, such as sweaty palms, sweaty feet, gummy smiles, raising eyebrows, and even neck lifts. So I've included this slide just to help give props to Botox. It has been around the longest and is used the most in the medical community outside of aesthetics. So I just like to put this out there for those people who, are not as familiar with Botox. It actually is used in a lot of medical applications and provides a lot of therapeutic benefits. It's used frequently with different types of muscle contractures and muscle spasms. It can help people with chronic conditions like cerebral palsy and help to address some of those issues that really there were not a lot of great treatment options before Botox. It can also be used to help correct lazy eye, and that is going to be something though that we wouldn't do in the aesthetic setting. So that's just for you to know. Ophthalmologists though can use this as an application to help correct lazy eye. It is used very frequently for migraine headaches, and they can really help for those people who have the chronic migraine headaches. That's not just for a headache here and there, but for the people who are struggling with difficult to control headaches. Botox can be a real lifesaver for those people. And additionally, it can be used in applications for bladder control. A lot of people may be suffering with issues of overactive bladder, and this actually can help resolve some issues of incontinence with that. So just to shed some light on other applications that Botox can do. And again, the other neurotoxins have not been around quite so long as Botox. So when you're looking in the medical community at what is being used more therapeutically, it actually would be Botox, whereas the other neurotoxins that we've discussed really are more so currently being used just in an aesthetic capacity. So Botox really is an awesome medication. It can help us in the world of medicine and in aesthetics. And even though it is amazing and I love, love, love working with it, it is important to remember that Botox is medicine, not magic. Botox only can relax muscles. As we've talked about, it's a neurotoxin. That means that the muscles can be weakened or completely relaxed with this medication only for a temporary amount of time. There are a lot of times I have patients coming in requesting different things for aesthetic appearance changes, and what they're actually asking for is not in the world of Botox. These are going to be things like lifting areas. I did talk a little bit about how we can make something have a little bit of lift. That is only if there is actually a muscle that is pulling downward. And then that way we can relax the downward pulling muscle and allow a little bit of a lift. But by itself, if you put a saggy muscle with saggy skin and you make it weaker, it's just going to create more sag. So just understand it is not always the right answer for when you're trying to make an area look a little more aesthetically pleasing. Also, it is not filler. So I get a lot of requests for people to put Botox into areas that actually have a deficit of volume. They have volume loss over time. And what they have to have at that point is a filler and not Botox, because relaxing muscles in an empty space isn't going to make that area improved and can actually cause an area to look worse, because then you're going to have even less movement there. And that skin, if there's laxity to it, it can actually make it a little bit worse because it looks more saggy. So it's really important to talk about your concerns and what your goal is with your provider so that we can make sure that Botox or another neurotoxin is exactly what you're looking for the look that you're going for. Also, one of the most common things that I see is that people come in with issues with skin texture. And especially here in Arizona, we have a lot of people with sun-damaged skin, and they come in with hopes that Botox can help improve their texture. Botox cannot address texture. That's something that we would have to address with a good skincare regimen, maybe some RF microneedling or lasers. Peels, and so forth. But Botox is not always the answer, unfortunately. So I get asked this question a lot. How long can I expect my Botox to last? Well, it varies. Just like everybody's metabolism is different, your longevity of your Botox will also vary. Some people on average will find that it lasts between 4 to 5 months. Some people may be a little sooner and some a little bit later. It does wear off in the lips a little faster, but this is also a very affordable area to treat. Some people may find that one product lasts longer for them than others, especially if perhaps they have used one product for a very long time. It may be beneficial to switch it up and try one of the other neuromodulators for added longevity. On average, 3 to 4 months is what you can expect for most neuromodulators. However, the new kid in town, Daxify, is stating it may be lasting up to 6 to 9 months, so I'm eager to see where that goes. How much Botox would I need? That is a great question. This is going to be really dependent upon a few things. Remember from our previous slides that everybody is different in how strong their muscles already are, how much space. For example, somebody may have a very large forehead, somebody may have a very tiny forehead. Some muscles are stronger than others. And then also the amount of movement that you want to have left behind. Are you wanting to freeze out an area, completely eradicate some lines, or are you just wanting some softening to the area? These all are going to make a big difference in your dosing, which is why it's really important to talk to your provider and make sure that they understand exactly the look you're going for, and they do a full assessment, having you go through those movements and looking at the strength of those muscles rather than just slapping some Botox in there and hoping for the best. They really want to take the time to make sure that those are going to be results that you're going for. It's also important to remember, especially when you're looking at price differences, that some of the neuromodulators are a little bit different in dosing. For example, you may see a really great price per unit on Dysport compared to the price per unit on Botox. It's important to remember that the dosing is different. For Dysport, it's roughly going to be 50 units are going to be comparable to 20 Botox units. Also, that newer neuromodulator, Daxify, that's going to be 40 units to the norm of 20 units of Botox, Xemin, or Jeuveau. So that's an important consideration to keep in mind. So how much Botox are you going to need? We've already talked a little bit about things that are going to affect your cost, such as the amount of surface area, the amount of space that we're taking up, the amount of movement that you want, how, do you want it frozen? Do you want it softened? What is your goal? And then those are going to affect price, obviously, per unit. Across Arizona, you can expect to pay anywhere between $10 to $15 per unit. Why the difference? That's going to be, one, dependent on where you are too. Here in the Phoenix Metro, I don't think you're going to find many places that are at $10 a unit. I'm not sure, maybe some Groupons or something like that. But for the most part, what you're going to find is that you're going to find more of an average between 12 to 14. And honestly, you have to keep in mind that injector experience is a huge reason for cost differences. And that may seem like a bargain then to go with the newer injector, but you have to also remember that your results are important. And it takes a significant amount of time as an injector to get used to injecting Botox and figuring out exactly how much it takes to do the job. It takes a lot of experience to be able to appropriately assess muscles and their movement and be able to determine in doses how much you're going to need to get the desired effect that your patient is telling you they want. So, for example, it's kind of a strange adage, but you've heard the old adage, no use in beating a dead horse, right? It's dead. Doesn't matter how much you beat it, it's not going to get up and go any faster for you. That's the same thing actually with a muscle, right? For example, if I have someone who wants an area and they want this completely frozen, they want to eradicate anything that's there. So I know, I look at the muscle movement, I look at how strong it is. And let's say I decide, for this little area of this muscle, I can do that in 10 units, right? So a newer injector, we got to eradicate it, we got to freeze it out. They may go a little heavier handed, right? They might put in 15 units. Or even 20 units, who knows? The point is, it only takes a certain amount to make that muscle do what you're wanting it to do, which is to completely relax if I put in 10 units or if I put in 20. If I've already decided that 10 is already going to make the job get done, then I could put in 20 units. It's not going to get more relaxed, right? Just like that horse. It's not going to get more dead. That muscle is not going to get more relaxed. So knowing how much you need to put into that muscle to get the desired effect is really important. And even more so if you're looking for an effect that's not freezing out, right? You didn't want to be frozen and they put too much in. That's not going to give you the desired look that you're going for, and you're going to have to wait a while for that to wear off. And that can be quite frustrating. So sometimes you literally may pay the same for an injector that is more experienced, because they're going to be able to dose that appropriately, and they may be able to use placement skills of where they're putting the Botox and the dosing that they're doing. They might be able to do that in a way that is a little bit more efficient for you. So you may actually have more of a desired effect with even less than the number of units as someone else who's not quite as experienced and maybe going more by the book on the standard dosing protocol given by the manufacturer, because that sometimes is kind of a heavy dose, which makes sense because they want to sell more product. So you may not need as much as the recommended dose for that area. And it's going to be an experienced provider that's going to be able to help assess that and decide, hey, this is the outcome you want. This is how strong that muscle is. I think we can get that accomplished with this amount. It takes quite a bit of experience to get to that point. So another question I want to address are risks of Botox. Everything in life has risks, and Botox is no exception to that. So one of the things that we always worry about with risk of any medication or even any new foods that you try, there's always a risk of having an allergic reaction. It is very rare to have an allergy to Botox, and I personally, I'm knock on wood here, personally have not had any patients be allergic to Botox, but you can be allergic to just about anything. So that's always a possibility. So anyone who has had a previous reaction to any of the neurotoxins definitely should avoid Botox as well. So another common possibility is that you could have a little bit of movement of the product into areas you don't want it to move into. So this can be minimized with proper injection techniques, as well as making sure that you follow your post-care instructions. They're going to make sure that they tell you to follow these instructions to help minimize the possibility of the product moving into an area that you didn't want it moving into. One problem you can see with product movement is potentially a ptosis. That is when one of your eyelids is affected by the neurotoxin. The muscles inside the eyelid are extremely, extremely delicate, and there is always a possibility, if you're putting Botox anywhere in the area in here, that some product could migrate in, and it doesn't take very much to create a little bit of a laggy eyelid. And so that's definitely something we want to avoid, and going to an experienced injector will help minimize any risk in that way. Also, another possibility is injection site complications. This is going to be important also with post-care. When someone injects the site, you could have, a little bit of bruising. Avoiding certain things. I will be sharing what I use for pre-care and post-care for Botox, but avoiding things like NSAIDs, ibuprofen, aspirin, Aleve, Motrin, Advil. Those things will help a little bit in minimizing your likelihood of developing any bruising at the site. And also any steroid use or blood thinners, those types of things, and alcohol use prior to could create more potential for bruising at the site. Bruising is usually quite minimal. It's usually almost like the size of a mosquito bite, and it's usually will just go away within a few days. Another injection site complication could be infection. So it's really, really important that you follow your post-care instructions. Your injector will clean the site with an alcohol swab or some other type of antiseptic cleaning solution prior to the injection. But it is very important that after you've had these Botox injections, you don't want to go home and put on, makeup, especially with like a dirty foundation sponge, or putting on makeup or any kind of chemicals on top of an open injection site is something you want to avoid. So we definitely want to keep that area clean and dry and avoid using makeup and applying any type of lotions or moisturizers until that has had a chance to heal. That will help minimize those possibilities. And then there's always the possibility for an asymmetry. Asymmetry just means that the sides of your face, they are what I call sisters, not twins. So this means that, you could end up having one side of your face being stronger than the other, and it may require more Botox on that side than it did on the other. And this could be something where if you've never had an injection before, you may find that one side of your face responds much more strongly than the other. And so this is something that gradually we get to know as time goes on. And usually asymmetries can be corrected. We do have to wait because a lot of times one side of your face may take the product faster than the other. And so we do like to wait for 2 full weeks after an injection to add any additional Botox that might be necessary. For example, if the wrinkles on one side of your face were just a little bit stronger and you were treated evenly on both sides, you might have to get a little bit of a touch-up on that stronger side in order to get them corrected. Another good point. So here is just a quick rundown of some of the pre-care instructions I like to provide for patients prior to a Botox injection. I always like to make sure that they're well educated on Botox, hence putting together Botox 101. As I spoke about in avoiding some of the complications for bruising, this has a list here of some of the medications that you're going to want to avoid, as well as supplements that can cause just thinner blood, which increases your chance of having bruising at the injection site. You can always take Tylenol unless you have a health condition where it's otherwise contraindicated, an hour prior to your appointment that can help with any discomfort you may have. Also, if you have a lot of concerns about pain, you could talk with your provider prior to this and have them schedule in some extra time and usually an additional cost to add in some numbing agent onto the face prior to injection. That's always an option for those patients that feel it's necessary. If you have a history of having cold sores on your lips and you're going to be getting your lips or anywhere around the lips injected, please make sure that you've let your provider know. It's a good time to make sure that we just give you some preventative medication to help prevent an outbreak of cold sores. Whenever you have the cold sore virus, it's going to basically kind of live on the nerve that hangs out around the lip, and any kind of trauma such as extreme sunburn or extreme chapped lips or Botox injections into the lips or fillers, those types of things can really get the lips agitated and could prompt a cold sore outbreak. On the right side here, it does just show a few little tips that I think are very helpful. Avoiding alcoholic beverages 24 hours. That way it will help decrease your chance of bruising. Also, having sunburn irritates that skin, and that's something that we want to avoid. So make sure that you don't come in with any wounds, irritation, or sunburn on the skin that you're planning on having injected. Make sure that you have a little bit of food before you eat. A lot of times those first of the morning patients came in, they were running late and maybe didn't have a chance to have breakfast. Sometimes people just get very nervous and can get worked up and could cause them to feel a little woozy. So it's a great idea to have some food prior to your injections. We also want you to not have anything that's going to irritate the skin in the area where we're going to be working. So this is going to include, getting waxing done, bleaching, tweezing. Also, it's important to know, don't want you to use any laser type treatments like laser facials, photofacials, that sort of thing, or any kind of ablative treatments prior to having the Botox, because we need that skin to be nice and healed. It's also really important, just common sense wise, make sure that you don't plan to go get Botox right before a big event. If you've got a wedding or something where you're going to have a lot of photos taken, you're going to want to make sure that you've given yourself a full 2 weeks. Remember how I did say that sometimes it can take maybe a little bit of time before both sides of the face have gotten into the swing of things. So one side may start to relax before the other, and you don't want any unnecessary asymmetry for a big event. And you especially don't want to have to worry about covering up if you did have any bruising at the injection site. You don't want to have to worry about trying to cover that up. Anybody who is using Retin A, you want to make sure that you discontinue that for 2 to 3 days before treatment. Again, that just does cause more skin irritation, and the idea is just to keep the area clean and dry and not having any irritation to the area that's about to be treated. So after you've had your Botox treatment, they should give you post-care instructions. And here's just a little summation of some of the ones I like to provide. So again, like I spoke on before, it can take up to 2 weeks before the full effect has been made with your Botox injection. So that's why we do wait at least 2 weeks before providing any type of touch-up, because you never know, sometimes right before that 2 weeks mark, all of a sudden everything settles in perfectly evenly, and you really don't know until that 2-week mark is passed. So I tell everybody with filler and with Botox to not love it or hate it for at least 2 weeks, because the results are not final until 2 weeks is up. Also, just remember that if you are wanting to keep these muscles getting a little bit weaker, not coming back as strong, it is important to go ahead and make sure that you schedule your follow-up so that you don't find yourself running behind and suddenly you look in the mirror one day and realize, something looks off. And then you realize that you're overdue on getting your Botox, and some of the lines that you didn't want to see coming back have come back. So that wraps up our Botox 101. I hope that was helpful. Again, it was very short and simple, but hopefully it addressed a few of the questions that you may have. The most common questions that I get in the primary care setting for those who are curious about dipping their toes into the world of aesthetics and Botox. Please feel free to send me an email. My contact information will be on the next screen, as well as stopping into Fusion Medical Care. You can stop in there and see me. I can provide an aesthetics consultation so we can talk about, is Botox something that's going to address the issues you're looking at, or if it's something else that we may need. But either way, I'm happy to go with you on your aesthetics journey and look forward to making more videos. Maybe we'll work on Botox 202. Thanks and have a great day.